CEREC is a newer technology where when a patient is needing a crown, instead of taking an impression and sending it out to the lab, we're digitally scanning the prepared tooth, and it goes to the machine, and we can design the crown so that we can have a specific shape that we want, or a tighter contact, a longer contact. And it gets milled out from a machine in the office on a block of lithium disilicate, or zirconia, whichever material you choose to have made. Then from there, we polish and we stain and glaze and put it through the oven, and then we are able to cement it for the patient the same day. A lot of patients have a busy schedule and don't want to go through a phase of wearing a temporary that may be uncomfortable, or it may fall out easily, and they spend a couple hours of quiet time, get their permanent crown placed, and then can leave the office with a new restoration that day. So the CEREC crowns are convenient for the patient because they don't need to make that second trip to the office, and they don't need to be numb twice. They come and relax, and then they go out with their permanent restoration. So with the CEREC, the fit is always 100% accurate to give the patient the best function that they would need.